Good morning, everyone. Oh, I just had to go to the post office to mail some pictures off to a cousin of mine, and I thought I could. They used to have two mailboxes outside in the parking lot that you just drove up to and dropped your mail in, and for some reason those mailboxes are gone. I don't know when they took them away. So now you go in and they have drop-off boxes on a wall. So thankfully you don't have to stand in line. So I did that, and then I thought I'd call you up and tell you about my emergency visit and say shame on you, emergency room doctor. So I did end up going to the emergency room yesterday. I forget when. Oh, I think it was just before lunch or just after lunch. And I went because I guess it's been going on over 2 weeks now. I've had awful pain in my lumbar and left hip, and the pain gets so bad that it sends my back and spinal cord into spasms. And if you follow me, you know I have a spinal cord disease called syringomyelia. Well, when that gets to hurting and spazzing, it triggers off the brainstem disease, the Chiari malformation, and then I get those awful migraines. Yesterday I did not have a migraine, not even a headache of any kind, but I was starting to have a lot of tingling down my legs. I'm used to the sciatic nerve on both legs, but the tingling doesn't happen too often, and I was becoming unsteady. So I did call my primary doctor yesterday morning and had to leave message with the call center, who was supposed to, maybe they did, at least get the message to her nurse. But I never got a call back. I never got an email back on my portal. And yesterday being Friday and coming up to the weekend, I did not want to have to be down in bed or just sitting around all weekend. You know that that's not me. So I thought I better probably go to the emergency room. And I always have it in my mind, even if they can't help, at least it's documented. And the emergency room I went to is part of the same network that all my doctors are in. So at the ER, they're able to pull up my health portal and see any medications I'm on, any that I've been on in the past that didn't help or that maybe made me sick because I have such an intolerance to medicine. They're able to check all of that, and they supposed to network with my doctors since they're all Baylor. So I go there, and I didn't have to wait too long in the waiting room. And then I get into in the lobby. Then I get into the room where the nurse takes you and they take your vitals and you wait for the doctor. And the nurse was very nice. And then it really didn't take too long, I don't think, for the doctor to come in. And just a few minutes after he started talking, I could tell that this probably isn't going to be good. And the reason why I say I could tell is because I used to work in the medical field, and I used to have to do assessments when I went into people's homes. I did home care, I did nursing home care, I did rest home care. So I used to have to do assessments, and you're checking to see, well, basically if the person is all there, if there aren't anything. Do you get the feeling that the person likes to be on things and maybe isn't as bad off as they're saying, and they're just trying to get some medicine, Anyway, he was doing that to me. And I had written on the admission thing a flare-up of the syringomyelia triggering the Chiari malformation. And so after a few minutes of telling him about the lumbar pain and then the spinal cord spasms and how that will trigger those Chiari migraines and all that, he said, well, he acted like I shouldn't have been there, because he said, well, if your spinal cord, is giving you problems, and if you've done damage to the syrinx, or the syrinx has something has happened to it where you need spinal cord surgery, we have to send you in an ambulance to a bigger hospital, because we don't have spine surgeons here. And so you don't look like you're in that kind of distress. I didn't say that that was the problem. I mentioned the syringomyelia, the spinal cord disease, hoping he would be familiar with it and be aware of the awful pain that it causes and how it will trigger the Chiari. Obviously, I knew that nothing had happened to the syrinx or that I needed spinal surgery. His tone in his voice and the way that he said it was not getting any better. And he checked my reflexes, in my knees. He checked my strength in my legs, because I complained about that tingling. And all of that went pretty good. But then he says, emergency rooms are like if you've been in an accident and a limb is hanging off, you come to the emergency room. You don't necessarily come to the emergency room for chronic deliberating pain, or even for migraines. Maybe if he said maybe if you're having chest pains. I don't think he should say maybe if you're having chest pains. And I have been to the emergency room for migraines. I've been advised in the past by my neurologist, get to the ER, and he was going to call ahead of me. So, I told him that I tried to go a different route before I came to the ER. And he said, well, what route did you try? Because you can't be going here and there and all over yonder to try to get pain medication. He's coming across accusing me of something that I was not doing. I wasn't going here, there, and yonder. I started with my primary doctor, not even to ask her for any kind of pain medication. I called her in the morning to make her aware that things have not let up. I felt like things were progressing a little more because of the tingling, and that's where I started. So, and I told him that, and he said, well, what did she say? I said, I never got a call back, and I never got an email back. That's why I'm here. And he says, well, we don't know you. We don't know your health condition. We don't know your medications. I said, I know that, but you're also a Baylor hospital, and I know that you can see all of that if you go on the computer. And he said, oh, that's right, we can. But what do you want from me? He said. I said, well, and I explained I didn't want to go through the weekend suffering and being down, not being able to do even just little chores. I said, I live alone. I don't want to risk a fall with these legs getting tingly. And so I says, I have a neurologist also. So then he said, well, I'm gonna call those doctors. And he went, and then he came back, and he said, I couldn't get a hold of your primary. I couldn't either. But he said he talked to the neurologist, but before that, he was saying we can treat you here for the pain, but you drove yourself, you'll need a ride home. I said, that's out of the question. I said, but you could, whatever you're going to treat me with here, you could send that same prescription to the pharmacy. And he says, there are a lot of people coming through the ERs looking for that. And I'm sure there are, but I'm not one of those. I let him know. And I said, you've taken an oath as a doctor. I don't care if you're a primary doctor, you know, or a doctor for kids, or just the elderly, or if you're just an ER doctor, you've taken an oath. And I told them, I don't appreciate you coming across to me. I said, you come across to me like you're resenting me coming to the ER. And I don't appreciate it. I think it's very unprofessional. But anyway, then he left to call the doctors, then came back and said he couldn't get a hold of my primary, but he talked to my neurologist. And he told me that my neurologist told him that I'm not one to always be calling for any kind of pain medication. Things have to be pretty bad. Now, I have a high tolerance for pain. It's a gene I've gotten from my mother's side of the family. And it's good and bad. But I mostly complain about the pain when it's to the point that it's deliberating, where I can't even stand to wash some dishes. It's hard to stand to make a meal. You know, then I feel like I need some help. Yeah. So the neurologist advised him what to give me at the ER, which they gave me 2 Tylenol and a shot of Tramadol, and sent over 2 or 3 prescriptions to the pharmacy, which is a whole nother story. They're still at the pharmacy. But, you know, this is the thing. I'm very well aware of the addiction in this country, where people are so addicted to this and to that, and the help has been abused. I agree. But when the doctor, in my case, this ER doctor, has access to my portal, where he can see when was the last time I went to the ER and what was I there for. He can see when was the last time any of my doctors gave a pain medicine. You know, was it last week? Was it 6 months ago? I mean, those things tell a story about a person, and he has access to look at all of that before he comes across, like, in his words, I'm going here, there, and yonder to try to get something for the pain. That's not me. I'm not that one. And I'm also not the one that will put up with being treated that way. Now, I try to be kind to everyone, and I try to give everyone the benefit of the doubt, like I've said so many times. Maybe this one or that one is having a bad day. I try my best with God's help to be kind and all of that. But when you're being, you know, treated that way, almost borderline accused, and also feeling like I'm being resented for going to a place where they're supposed to help, that I don't stand for. Now, God helps me to be assertive without being rude and without cussing and putting down his profession. Now, if it was someone else, hey, there are people out there that are hot-tempered, quick-tempered, and they'll use all kind of language to let someone know how they feel. And I'm not that person either, but I don't have a problem being assertive and advocating for myself. I don't. And so I am glad that he did call the doctors. And the primary doctor he couldn't get a hold of, just like I couldn't. So that went to show that I had also tried and got the same response, you know. And I'm supposed to call the neurologist Monday and also call, oh, I have a cardiologist appointment on Wednesday. We'll see about that one. But I'm gonna call the neurologist Monday. Now, I did call my primary doctor last week for a referral to see a physiatrist, not a psychiatrist and not a podiatrist, but a physiatrist. And I say that because when I called my doctor's, you can't just call my doctor's office. You call the main number. It's a call center. They take all your information and send your message to the nurse and supposed to send a copy to the doctor. I don't feel like they always do. But these are medical, supposed to be a medical assistant people that are familiar with different doctors and different medicines and different conditions. And she just could not, I don't know if she couldn't hear me. She kept saying psychiatrist. I said no, physiatrist. Podiatrist, the foot doctor. I said no, physiatrist. Do any of you know what a physiatrist is? I had seen one years ago back home, right after I got diagnosed with the syringomyelia, and that lady was thorough. I mean, ran blood work, checked for everything. Asked so many questions, pressed here, pressed there on my body, you know, to find places of pain or whatever. It was like 30 years ago. I don't remember all that I went through, but I was very impressed with her. And I thought, I just feel like maybe I need to see a physiatrist, which studies all of your body, your skeletal, your muscle. They're very good. Well, that one was. We'll see. So the doctor did send a referral once I made the medical person clear of what a physiatrist is. And I called yesterday because I got an email that the referral had been sent and the rest is up to me to call to make the appointment. I called and they said, if this is for pain management, then this doctor is not taking new patients. But if this is just for an overall, you know, checkup and discussion, she's taking new patient. And I said, well, that's what I wanted it for, but I don't know what the referral says. I don't have a copy of the referral. Do you have a copy of the referral? And she said, we didn't get a referral. I said, well, I have the email in my health portal saying that the referral was sent, and that the rest is up to me. And she said, that's not how it works. Once we receive the referral, we have 5 days, which I don't understand, and then we'll call you. I said, oh. So I'm thinking that a referral is instant, either faxed or emailed, just like the food stamp thing I'm dealing with. So I said, okay, I'll just leave it as is, and I guess when you get the referral, you'll call me. But if it should not say for pain management, because I want to start off with just an overall checkup thing, so that I can be seen by the physiatrist. So that's where that's at. I have such an intolerance to medicine. In fact, when I had the 2 reconstruction shoulder surgeries 5 months apart, the only time I had a pain medicine was when I was in the hospital. They sent some home in a push thing, in a Ziploc baggie, and a prescription for narcotic. I'm not going to name it, but You can figure everything out. And then I had the nurse come in. She was a nurse slash something else. And she said, your prescription is on the table. Do you need me to go get it filled, or can you call someone from church to take it? I said, I don't need it. I mean, my pain tolerance is so high. Even after, when I was recovering from this, I was still able to get up, and I would struggle to make the bed with one arm. I would try to sweep. I could sweep my floor with one arm, but I couldn't get things in the dustpan. So that kind nurse, she would put it in the dustpan for me. But see, I was up and just doing little things. But this pain and spasms and tingling that I'm talking about in my back and spinal cord and legs, I can't hardly get up and do anything when it is that bad. So that's why I called the primary yesterday, then went to the ER. And you know, a body at rest stays at rest. So it's really not good for me to just stay laying down or sitting down. I just like to be up doing things. And sometimes I do overdo it, sometimes. But with this, with these conditions, the brainstem disease and the spinal cord disease, there are times that you don't have to overdo anything. It just flares up and it gets really ugly. So that's where I'm at. That is where I am at. I mean, yesterday at one point, it was just almost to where I couldn't get out to give those chickens fresh water because of my legs from the spinal cord pain. I've read about dogs that get this spinal cord disease, syringomyelia, and boy, my heart goes out to them because they can't tell anyone. And babies that are born with it, and babies, it's becoming more and more that babies are born with the Chiari malformation, the brainstem disease that I have. And those poor little babies, I mean, they can't tell you or tell the nurse. But boy, oh boy. But I'm thankful for God helping me through it all. You know, God helps me to be calm with when someone comes across that way. I believe that God helps me to answer them the right way. You know, I'm not gonna cow down to them, but I'm also not gonna make a scene. And God gives me grace to get through the day. And I'm just so thankful. Just so thankful. I really do just take one day at a time. It's hard for me to, you know, plan things out. I try to plan some things, but I really just have to take one day at a time. And sometimes I have to pick different chores that I'm gonna do. I used to be able to just go right through that trailer cleaning, including washing floors on my hands and knees and all that. Now I can do the bathroom on my hands and knees, but it's not pretty getting up. And I prefer to do the bathroom that way, you know, just to get around behind the toilet and in the corners. There's no mop that I have found yet that gets in corners. And corners collect a lot of dirt. And especially where I live on that land and this Texas wind, and I'm in and out and Sadie's in and out. Got to keep up with the floors. So I've mailed that out to a cousin, and I'm gonna head back home. Yesterday, the Meals on Wheels lady came, and I was home to chat with her a little bit outside, and she brought she bought a container of fruit for the chickens and a little bag of coleslaw and a bag of frozen peas. She just loves the chickens, and she loves Esther, and she's trying to get Esther to eat out of her hand. And I think one day Esther ate some coleslaw out of her hand, but she's just a very kind lady. And I'm sure the others that come are nice too. I've only met 3 of them. And yesterday she texted me that she was running really late. The van, the Meals on Wheels van, was running late. And then she said something about, in this summer weather, having a little bit of a shortage with volunteers. I can imagine. Now I have spotted 3 kittens, and I'm a little confused about it. I guess 2 mamas, because both of those mamas sit out, and I'll see one of the kittens always at one mama, but then I'll see that same kitten at the other cat nursing. And somebody told me that female cats will adopt kittens and nurse them, but don't they have to have milk to do that? It only makes sense. So I can't figure it out. I've been trying to get a hold of the landlord's, one of his nephews that took those other 3 kittens, to see if he wanted any more. I heard that he did from his mother. Then I heard from someone else that they did not want any more because a couple of the ones that he got from me were having kittens. Now I recently heard from my landlord that yes, he's still looking because he's on lots of land and there's mice, and he has I don't know if it's a barn or a shed that he has for those kittens to go in, and he is looking for more. So I'm trying to take care of that. I was just gonna give up because that one, well, she's not a kitten anymore, just kept staying around, and I thought, well, I'll just keep this one around. I didn't know if it was a male or a female. Now I know it's a female, so it does need to go in these kittens too. It's not gonna ever solve the problem though when you live out like there. But, well, I'm gonna get home. I put some of that fruit that the Meals on Wheels lady gave me, the grapes and the cantaloupe, in the freezer to give to the chickens. They will love it. They will love it. Oh, please go to my post page. Please, please, and please, and please. Because the very kind lady, Tina, that bought that gray, pink, and white baby blanket from me that I had shown in the video, she received it yesterday and emailed me, and she emailed me a picture of it that she has displayed over a crib, and I copied that picture and put it on my post page because I thought it was so kind of her to take a picture and send it to me, and I wanted to show all of you how it looks, you know, on a crib, because I had just shown it on a blanket ladder. So please go to my post page and see that, and leave a comment letting me know so that I know that you did go there and see it, please. All right, I'm gonna get home. I just wanted to share all this with you. Hey, God is still on the throne. He's still large and in charge. And that's about all I gotta say about it. I'm thankful to know that. And aren't you? Okay, I'll talk to you later.